everyone, this is Consuelo. Some of you call me Connie. I am part of Group 1, and my team members are Irina, Dawn, Ariel, Kaya, Nina, and Brianna. We are all here to talk to you about medication safety, emphasizing on how to prevent medication errors. From watching this video, you should be able to define medication error. You should know some common factors that contribute to medication errors, and we will be categorizing these into 3 sections. You should know the nurse's role in medication administration. You should be able to list steps of the nursing process and have an understanding of how it contributes to medication safety. I know we went over this already, the 8 rights, but they're very important, so we need to make sure that you don't forget. We will also be going over the 3 patient checks. It's really important that you know when to do these 3 checks. And lastly, we want you all to know methods that can help you reduce medication error, because I'm sure we wouldn't like to have medication errors in the future. And now I will be talking about what are medication errors. Medication errors are preventable events that may cause or lead to inappropriate medication use or patient harm, while medication is in the control of the healthcare professional, patient, or consumer. Basically, medication errors can happen from the prescribing phase to documentation and monitoring. So we have a lot of room for error. So it's really important that you pay attention to this presentation so that you can avoid some of these errors.
Medication errors happen all the time and they can be fatal, so it's really important to keep in mind. It's an important concept. As healthcare providers, we have to be aware of the potential for error and work to prevent it. Errors can happen during prescribing, dispensing, administration, or documentation phases of administration. The error can be detected by the pharmacist, the doctor, the nurse, or other staff. And many errors occur during patient transfer. So when a patient is being moved maybe to a different unit or to a different facility, it's quite common then. So medication reconciliation forms, they're used now in a lot of places to prevent meds from being omitted during transfer, and it prompts the doctor to review existing meds when transferring. So also rounding at the end of shift, at the beginning of shift is really important, so the nurses can tell oncoming nurses and staff about any medication changes. So it's important to utilize rounding in the proper way. The patient wristbands with the barcodes helps make sure you have the right patient for the right drug. Nurses should also always verify with the patient their identity, asking them their name and their date of birth. And for nonverbal patients, we can use photo identification. Nurses are responsible for knowing about the medications they're given, so what they're for, any adverse effects. It's really important for us to know about that. Patient teaching is also important, because if you have an educated patient who is informed about the drugs they take, they'll be more likely to know if they're getting the wrong pill or if there's any changes. So it's really important as nurses for us to know pharmacology, so that we can recognize how the drug acts in the body, how the body acts on the drug, and if there's any adverse effects, anything serious or side effects, so we know if something is going wrong. So as nursing students, it's really important for us to take it upon ourselves to learn pharmacology. So we have the system and environmental factors I discussed, how it happens during patient transfer, and a lot of these errors occur when there's increased workload or when you're working with acutely ill patients. Distractions, fatigue is a big factor, and distractions as well. Nurses often get distracted while doing medication administration or just throughout their shift, but it's really important to just, when they're giving medication, focus on that and not get distracted just for that remainder of time. And then also problems with medicine supply and storage. So some things I touched upon was the medication reconciliation form, and then as well as with rounding, you really want to have efficient and effective rounding, where the nurses aren't just kind of glancing at the patient for a second, but actually going into the rooms, spending time with the patients, talking to the patients, addressing the patient's needs and asking them if they need anything, and just really seeing what's going on that way. That's important. So also with the wristbands, with the barcodes, nursing knowledge of medication and patient teaching. Medication errors they can lead to really adverse events and they're preventable. So it's important we take them seriously.
So now we're going to discuss some examples of medication errors. You can have the wrong medication for many different reasons, some of them not under control, such as mistakes at the pharmacy or illegible prescriptions. You can have drugs with similar names. This increases the risk of pulling the incorrect medication. You also have like administration errors, such as going to the wrong patient. If you give Jane Doe's medication to Jane Smith, depending on the medication, who knows what could happen, And then you have wrong time errors. So this is one of the most common medication errors. Some drugs require a very narrow window to achieve like desired therapeutic effects or to avoid adverse effects. But sometimes you're just too busy or you forget. Many different things can happen. Then you also have wrong route. So if you give this woman here a transdermal patch or an IMED via PO, they can die possibly. So you also have wrong dose meds, wrong dose errors, and then like little Kathy here, if you give her too much Benadryl, she might never wake up. And this could be due to like incorrect prescription or as previously stated, a pharmacist can make mistakes with the dosage, but you also could do like incorrect preparation yourself, such as correct dimensional analysis or whatever. You also can give like the wrong form of medications. So if you give an enteric-coated pill but you crushed it beforehand, they might have silent nights for the rest of their life. And then we also have like IV meds, which can be administered incorrectly. The IV can be inserted incorrectly or with an inappropriate catheter size, leading to either like infiltration, extravasation, or phlebitis. Pushing meds too fast can cause nausea or more serious reactions. If a central line is used and you push it too fast, it can result in like pneumothorax. Wrong infusion rates can be set, which can alter therapeutic effects or cause adverse effects. Improper techniques for injections are also can also produce errors. Can also be a medication error. So if you give like a subdermal injection at an angle greater than 15 degrees, you can it won't achieve the desired effect. Can also have improper aseptic techniques. So like this can cause a lot of different issues. So if you're not properly washing your hands, or if you're giving like dirty needles, this can lead to infection or like endocarditis, maybe some death. Some other errors are like drug. Some other errors would be or like just like just not knowing your patient, not monitoring your patient well, or not knowing drug interactions or contraindications. So if you give a patient that's PO, a patient that's NPO, a PO med, you can cause them to aspirate, which can lead to pneumonia or death. amongst other things. Um, like if you're giving if you don't know like drug food interactions, you can give like grapefruits. If you give grapefruit juice or like statins together, this could be no bueno. Or like giving antihypertensive medications to someone without first checking their blood pressure. Um, it can cause them to get like dangerously low blood pressure. Or giving digoxin to a patient with a pulse below 60, or failing to take account like renal or liver function before giving some meds could cause liver failure or renal failure. And then we also have like compliance errors, which are like um, when protocols or rules of the hospital aren't met, maybe you don't follow them. Yeah. There's other things as well, of course. Um, so, can you guys list like 5 medication errors that weren't listed here? Let's see.
Nurses play an important role in medication administration. Their main job is to ensure that their patients are given the correct medication that was ordered at the correct time. The nurse's role as caretaker puts the nurse in the position of being closest to the patient and best able to assess both the patient's condition prior to use of the medication as well as the patient's response to the medication, 2 important parts of medication therapy. The 5 steps of the nursing process that ensure safe drug administration are assessment, nursing diagnosis, planning and goal setting, intervention, and evaluation. The assessment process is ongoing as patients' conditions may change. Nurses must continuously monitor drug effects, both therapeutic and unintended. A complete medical history and nursing physical assessment are parts of the assessment step. The nursing diagnoses are statements of patient problems, potential problems, or needs. Understanding the nursing diagnosis will ensure proper drug therapy. During the planning phase, the nurse must familiarize himself or herself with any special information or equipment needed to administer a medication. Because many medications are administered by the patient himself or herself or the family, teaching is an important part of the nursing process for drug therapy. The intervention or implementation phase of the nursing process involves carrying out the planned activities. Ongoing assessment of the patient is necessary before every intervention. Because medication errors can occur at the point at which the prescription is actually written, the nurse's checks are a key means of restoring accuracy to the treatment process. The evaluation phase of the nursing process is also a continuous process of determining progress toward identified goals. For some medication, the response can be quickly identified. For example, relief of pain following administration of a pain medication. For other medications, the response is slower and must be monitored on an ongoing basis. A newly prescribed antihypertensive medication, for example, may require follow-up visits to the clinician's office for blood pressure checks and assessment of side effects. Finally, documentation is an important part of reducing medication error. Documenting every medication that was administered and the time that it was given prevents giving too much or too little of a dose, and allows us to keep track of any side effects. Pain medication and other controlled substances are an important example in nursing documentation. Nurses are required to keep controlled substances locked in a secure room or cabinet, administering them only to patients with valid prescriptions or physician's orders. Nurses must maintain accurate records of each dose given and the amount of each controlled substance on hand, and must report any discrepancies to the proper authorities. This concludes the nurse's role in medication safety administration portion of our presentation.
Hey, you Nathan?
Yeah.
Wrong Nathan.
Before giving a medication, it is imperative that you have the right patient. To do so, use 2 patient identifiers and cross-check the medication order and the patient's ID. In fact, there are 3 checks that must be done to continually verify the patient's identification. Verify you have the correct patient when looking at the MAR, when dispensing the medication, and when at the patient's bedside. If the patient is able to do so, have them verbally confirm their name and date of birth. And lucky for us, we can now simply scan our patient's wristband for easy identification. Number 2, right medication. Okay, listen, so many of them look the same. Alprazolam, lorazepam, why? But this is what we signed up for, so know what medication you are giving. Make sure you read your medication order carefully, and if you are not familiar with the medication, check it up in your drug reference. Verify you have the right medication and that your patient does not have any contraindicated health issues or medications that are already being taken. Double check your high-risk medications with another nurse to prevent medication error.
I don't know why I'm taking these, but they are so good.
Now it is time to use that smart noggin of yours. Does the medication you're about to give to the patient make sense? Does the patient have a condition that will require this medication? Does the patient have an allergy or other medical conditions that would contraindicate the need for this medication? Cross-check the patient's history with the medication order in order to determine that the medication is appropriate. Number 4, the right route. You want to make sure that you're giving your medication in the correct manner. Verify the correct route through both the medication order as well as the medication label to make sure that it is appropriate. Once you have verified your route, look for other details that can be important. If a subcutaneous injection was ordered, you should be aware that injection sites should be rotated. Understanding that enteric-coated pills should not be crushed can prevent medication error.
Hey everybody, so in this segment of the video, I'm going to continue reviewing the 8 rights of medication administration. And so the next right will be the right dose. We always want to make sure that our patient is receiving the correct dose for the medication that they've been prescribed. We can take a look at a drug reference, and that would be able to provide us with the dosages that a patient may require based on the medication that they're receiving. And so this dose may vary due to their age, if they're a pediatric patient, if they're an adult patient, what their weight is. But regardless, we always just want to make sure that the dose that we're giving them is the correct dose. We don't want to provide them with a dose that isn't enough so they don't experience any type of therapeutic effect, and we want to make sure that the dose isn't too high so they experience an adverse effect as well. If we ever need to calculate a dose, we can always verbally confirm our findings with another nurse, and this can provide us with a fresh set of eyes to kind of take a look at the dose that we're looking to give to our patient, just because as a nurse there may be situations where we have a really high patient load or our day may be very, very busy, but we never want to sacrifice the patient's health and giving them the correct dose just because of what our day may look like as a nurse. The next right would be the right time. And to verify the right time, we can take a look at the patient's order, and we can also look at the MAR. This can give us information about when the last dose was given and when the next dose is due. It's really, really important to always make sure that we give the patient their medication at the correct time. If we completely miss a dose or we give it at a much later time or a much earlier time, this can result in some pretty serious side effects that the patient may experience. And so the right time kind of has a twofold view in that, first of all, the patient will be the one who suffers. Their condition may be exacerbated, their pain may worsen. And secondly, as a nurse, we may be put in a situation that our ability to perform our job may be questioned, just because if you've ever been at clinical and if this situation has ever occurred, you can see that if a nurse ever gives a medication too late, a notification will pop up in the patient's chart, and it'll ask you in a pop-up, why are you giving the medication this late? And so maybe the hospital administration may begin to question why this occurred, the charge nurse, the patient's family. And so it's just very important to make sure that the patient always receives their medication at the right time. The next right would be the right response. So as a nurse, it's really important for us to know what the expected outcomes are for our medication and how the patient should be responding. So for example, if we administer an antihypertensive medication, we need to know and we need to see if the patient's blood pressure is actually decreasing. Additionally, we need to know what the unintended effects are, the side effects are, what an allergic reaction looks like, what toxicity looks like. Just because if these situations do occur, we need to know how to address them and how to respond as quickly as possible to prevent the least amount of damage to the patient. To verify the right response, we can always take a look at the manufacturer's guidelines, and we can also take a look at a drug reference where this can kind of highlight what the expected outcomes are. This is especially important if we've never used a certain medication, if we have limited experience with a certain type of medication, just so we know what we should be anticipating once we administer the medication to our patient. Medication administration and the right response can be subjective and objective as well, in that as a nurse, we can take a look at their patient and kind of see how they're looking. What do they physically appear as once we've given the medication? And we can also use information from the patient. We can ask them, how are you feeling? And they can give us some really important information that can help tailor our approach to their treatment as well. We can also use their labs or their vitals to give us even more information and just to make sure that the response that we're looking for is what the patient is actually experiencing. And lastly, in regard to the right response, it's always really important that we follow up with our patient once we administer the medication and we monitor them. We don't want to just give a patient a medication and disappear, for an hour or two, because in that time following the administration, that's when we can see if the right response was actually achieved. And lastly, we want to make sure that we have the right documentation. We always want to make sure that we document a medication after we've given it, just because if the medication wasn't given, we need to provide the correct information as to why. We need to say why it wasn't given. Was it because the patient refused? Did their family refuse? Was there a medical reason, such as if we go back to our hypertensive medication, let's say the patient's blood pressure needs to be within a certain range and it's below this range. And so as a nurse, we make the clinical decision to not administer this medication. And we also need to make sure that we document what we did instead. This provides us with a paper trail and it protects us as a nurse. So if later on something comes up where the patient's chart has been audited, we know what we did and why we did it. We also need to make sure that we document any pertinent labs or vitals related to the specific medication that we're administering, if that's necessary. And we need to make sure that we document and monitor the process and the patient's progress as well.
We know that medication error is defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while in control of the healthcare provider. Sometimes as students, we may think medication errors are not as common as they actually are, but in fact, medication errors contribute to significant mortality. Our pharmacology book states that medication errors account for every 1 in every 131 outpatient deaths and 1 in every 854 inpatient deaths in the United States. Therefore, medication errors account for about 7,000 deaths annually in the US. So as we can see, medication error is no small matter in nursing practice. With every type of medication comes different risks and concerns. IV medications pose the greatest concern if an error were to occur because over 61% of IV medications have serious life-threatening side effects. Severe medication errors are considered a never act, which is defined as a clearly identifiable, preventable, and serious in their consequences for patients. If a never act were to occur, insurance companies will ask the hospital for a refund or they will not cover the additional cost of care for that patient. According to an article in the National Center for Biotechnology Information, it found that tiredness due to increased workload was the most common cause of medication error in nurses. To be more specific, it found that 97.8% of errors were due to fatigue. This study was also interesting because it took into consideration nursing students, and it found that drug calculation was the most common cause of error. In another research article called Does shift work impact the occurrence of medication error among hospital-registered nurses? Analyze the occurrence of medication error, its contributing factors, and the different types of medication errors. This study took place in 2015 and was conducted in 3 different privately owned hospitals over a 2-week time frame in Buffalo, New York. It looked at self-reporting medication errors from the nurses during day shift and night shift. So think to yourself for a second, which shift do you think would have the most medication errors? I'm kind of leaning towards day shift just because it's busier, there are a lot more interruptions, but then I also see night shift, well, because sleep deprivation and there's less resources available. So what this researcher hypothesized was that night shift would have more medication errors due to fatigue. And actually what it found was that day shift had the majority of errors. But what I really liked about this study was that it broke down the 12-hour shift into 4-hour increments. And what it found was that the last 4 hours of day shift had the most medication errors, and then the first 4 hours of night shift had the most medication errors. It also showed that night shift made more mistakes that involved giving the wrong drug and the wrong medication. So as we can see, human error is inevitable in both shifts. This study divided medication administration errors into 7 different categories, and what it found was that documentation error was the largest category. Documentation error had 87.5%. The second was technique error with 73.1%. Third was wrong timing with 53.6%. Next was dose error with 23.1%. Then misdrug, misdose with 8.3%. And wrong route with 2.8%. So as we can see, medication error can be made during any step between prescribing and administering. And as nurses, we will have direct control over the administering part. So understanding why, when, how medication errors occur is important so hospital administrators and nurses can implement policies to reduce these errors. Human error is inevitable and we cannot eliminate it entirely, but we can measure the problem in order to create a safer system.